Let's say you've seen the dentist and the dentist says you need to take your son, Anthony, to see an orthodontist because he has crooked teeth and he has a bad bite. Go see the orthodontist. So you as a mom take your son in, and the news you get is, yes, we can definitely straighten his teeth. Yes, we can give him a nice smile. But to fix his bite and to get everything to mesh well, he's going to need jaw surgery. Now just imagine that this is your son that you're talking about. He's 16 years old and you never saw this coming. Now I had the great luck and fortune 7 years ago to take a course where I met a Japanese professor, Professor Sadao Sato, who gave a lecture on this technique that was not invented by him, that was invented 25 years ago by a Korean orthodontist who had immigrated to the United States, called the Multiloop edgewise arch wire technique, also known as meow. That's what we call it in the office. It's a technique where you use the same braces, very special wires, and treatment time is usually very short, 14 months, and now we can treat about 70% of these patients that normally would need surgery, we can treat without jaw surgery. The process is you use the same exact braces we use on everyone. The initial wires are the same initial wires we use for everyone, just as if you were getting them ready for surgery. So the wires are the same, the braces are the same. Then as soon as the teeth are aligned, they're just straight, the bite is still off, at that point we take impressions from which I make models, from which I bend the multi-loop wires. They're very special wires. You use the same first set of wires throughout the whole treatment. So now the patient comes in, they get the multi-loop wires, and they wear those wires with rubber bands. Very important that they wear their rubber bands as instructed with the wires. Then what happens is, because the way we move the teeth, we allow the jaws to move and correct the bite in a very short period of time. So when the multi-loop wires go in, they actually only stay in place for 6 months. Then when the bite is corrected and we're at the point that we're going to do the final detailing, the multi-loop wires come out and we put regular wires back in with some special bands and rubber bands and finish up. So if you look at it, the multi-loop treatment actually goes very, very fast. It's faster than most of our other treatments, and it's faster than if you do jaw surgery. So our average time in multi-loop is around 14 months. But if we look at it now with the power of multi-loop, if you give me 10 patients that were treatment planned for surgery, I can treat 6 or 7 of those patients without surgery by doing multi-loop. We find that the stability in our finished multi-loop cases is very, very high. I want to say it approaches 90%. And I cannot tell you what that's done for our office and our patients. I mean, for me as an orthodontist, it's been a joy because my patients are so much happier. And they can see the relief from the parents when they come in and they hear that their children don't need jaw surgery anymore. I mean, that's huge. The whole office loves it because we see all our multi-loop patients be so excited about what we can do for them. So it is the single best thing I've ever done for my patients, taking this course. And my visits to Japan, I'm in complete debt to Professor Sato for the rest of my life. And I think my patients, I think the world of them. And I'm so happy that we can offer this technique.